Hey everyone, Dr. Hudson Frey here at the Buckingham Center in Austin, Texas. So we want to do a little video about rhinoplasties. What are rhinoplasties? What's the recovery like? What's the surgery like, etc. So a rhinoplasty is when we make changes to the shape of the nose. And so in a cosmetic rhinoplasty, I am opening up the nose, changing some of the underlying structures, and then putting that nose back together with the goal of making it look better. Whenever I'm looking at rhinoplasties, I'm also looking at the functional aspect of the nose, so I want to also make sure that you can breathe better from that standpoint. So I typically will wait until girls are around 16 or 17, boys 17, 18. It's kind of dependent on your latest growth spurt, maturity level, things like that. And then any age can have a rhinoplasty after that. I've done patients where their first time rhinoplasties even up into their 60s. So it's whenever you're ready to make that change to the shape of your nose. When you come in for a consultation, what we'll do is we'll go through a couple of different questionnaires. We'll take some photographs of you. I'll take a look at your nose, kind of see what I see from that standpoint of the underlying framework. And then what we'll do is we'll morph the photos that we take of your nose. And you and I will sit there together and we will go through and kind of talk about what goals we're trying to achieve and what I think is possible with your nose. So everybody's nose is different, everybody's face is different, and so there's only so much that we can manipulate or change, and I have to make sure that I leave you A, with a nose that looks good, and B, with a nose that works well or that you're still able to breathe out of. After that process, my surgical care coordinator, she'll come in and she'll talk to you about what it looks like to schedule. Should you schedule, we'll schedule you about 3 weeks before that, where we'll go over all the aftercare instructions, pre-care instructions. We'll talk about the recovery a little bit more in detail. On the day of surgery, you'll come in, you'll meet our anesthesiology team. Our anesthesiologist will talk to you about going under general anesthesia. And so you'll get an IV started, and then you'll come back to our operating room. I'll have your pictures pulled up that we talked about, as well as your before pictures. And then that way I've always kind of got that framework while I'm doing the procedure itself. It takes me a couple of hours to do the procedure. Afterwards, you'll typically wake up with a cast on the outside of your nose and some stitches on the undersurface of your nose. You'll go home the same day. The first couple of days, you will not be able to breathe very well out of your nose. So I just always warn all my patients that some people bruise, some people don't. I really focus on making sure that you get a high protein diet the first couple of days afterwards, that you're taking it easy. Some of my patients who are not claustrophobic or don't have ear problems, they'll choose to do hyperbaric oxygen. So that's where you sit in a little chamber and it pumps fresh oxygen into the chamber at a higher pressure. And then that can kind of help with some of the swelling, bruising, speed up the recovery process. So some patients really love doing that. I'll see you back at 1 week. We'll take the cast off. We'll take the stitches off. I usually joke with some of my patients, like there's a lot of times where the nose is swollen enough that you don't really love it that first day. And then I know that it's going to get better and better and better. So usually about 2 weeks, 3 weeks out, that's when you're really starting to see the vision, see the goals that we've talked about kind of come to life in your nose as that swelling decreases. And then I typically will ask that you avoid strenuous contact to your nose for about 6 weeks. So anything that could be coming out your nose like pickleball, tennis, things like that, I really ask that you avoid that for a solid 6 weeks afterwards. And then personally, I like for you to avoid any kind of glasses or sunglasses on your nose for 6 weeks afterwards. I usually see you around that 6 week mark. We take some photos. I see you around the 3 month mark. We take some photos. But I usually recommend that your final outcome is not going to be there until about 1 year after surgery. Now, it's different for everybody. Some patients have really thin skin and you'll get to see their final outcome a little bit quicker. Some patients have a little bit thicker skin and it takes a little bit longer to see the final outcome. And through that whole process, it's not like your nose is going to change significantly, but you start to see the refinements, the swelling, as the swelling decreases, the highlights that you'll see, where we really see the nice crisp definition in what we've achieved with your rhinoplasty. So rhinoplasty is one of my favorite procedures to perform here at the Buckingham Center. It's really why I went into facial plastic surgery. And so if you're interested in learning more, we'd love to see you here in Austin, Texas.